The biggest tip I probably have is to start early. So if I think Steve and we started around early August, and been kind of doing this, I think, in October. All we did was just meet a few times and kind of just run through easy cases, but it kind of jumpstarted our brain to kind of start thinking in that board mentality.
Yeah.
Another big tip would be that group study. Weekly, pick a topic, make a calendar, and make sure you kind of hit each topic every week. So if one week you do dental alveolar, you'll do implants, reconstruction, pathology, and then towards the end you'll kind of jumble them around. But at least in the first, couple of months, you want to make sure you hit each big topic, and don't shy away from like cleft and the pathology just because you're not familiar with it. You got to still kind of make sure you're hitting all those big topics because they will pop up on the boards. And then
Okay.
other big resources is reach out to your program, set up mock boards, with maybe prior residents or attendings, they're a very good resource. They've taken the boards, so they could kind of help guide you on that path to, properly answering the questions, not wasting time with your responses and stuff like that. And the big kind of thing is you want to be super broad when you answer with boards. You don't want to be, you know, fumbling around words, just throwing around buzzwords just to have like the examiners think that you know what you're talking about. You want to say like this is X disease characterized by X. You want it to be crystal clear, 2 seconds, so that they could ask you the question and you just move on to the next thing.
Got it.